A funny story about a nurse starting an IV on me was last week they used a vein finder on me for the first time to do this. And now that vein finder was, I guess, last 2 weeks because we can all find this damn vein. And then she tried to do one right here and it also blew. But she was also on the nerve at the same time, just a little bit. And I was like, ooh, like, like, we're tingling. We're on the nerve a little bit. She stops, looks at her coworker, and she says, I'm scared. I looked down at her hand, she's shaking. I'm like, take it out, take it out, take it out, take it out, take it out. She takes it out. She was so nice, granted. Like, this isn't her fault. I just am an exploder. And then the PICC line person came in. I don't even know what that means. But he tried this vein and it blew right away. And he was like, oh my God. Okay, shit. He didn't say shit. He was wearing Minion scrubs. And then he did this one and it worked perfectly and it didn't even bruise at all. I was like, ooh, nice. That was a good one. And then when I had this one right here, there was a nurse that came and flushed my line with saline and hooked me up to the IV machine after I'd been unhooked for 8 hours with no cap on my IV hub. And then she, without sterilizing it, without wiping it, just flushed saline through it and hooked me up. And I was like I was shocked. I was frozen. I didn't know what to do. I had her come back like 2 minutes later and I was like, hey, I just need some reassurance. Like, I'm immunocompromised and I'm just wondering why you flushed the line without wiping it. And she was like, oh no, like, it's fine. I used these caps. And she plucked a fresh one of those skinny green caps that fits on the tip of the saline thing. So, like, that's not a cap that you use to clean the IV hub. How do I know? I took pictures of all of it and put it into ChatGPT and said, what the fuck is this? Does this justification make sense? No, especially because she took a new one off the strip, the 3M strip at the top, and said, now this is contaminated and I'm going to throw it out. And I was like, you didn't use that on me 2 minutes ago. You just grabbed a new one off the top. Huh? So then I went and told the charge nurse. I was like, this nurse was really nice to me and I don't want her to get in trouble and I don't want you guys to like lash out on me. But I think we need to remove this IV because it's contaminated now because she's flushed it without sanitizing it. I'm immunocompromised. I have enough problems going on right now. I do not need another reason to be in this hospital. I do not need another reason to like have more medical problems. I'm not trying to like increase my risk of infection. Please, thank you very much. And the charge nurse was also like, it's not a big deal. Like, she's like, yeah, that's not how she's supposed to do it, but like trying to get another IV on you is going to be really difficult, and every single poke is like more of a risk of infection. And I was like, yeah, but the risk of infection of attempting a sterile IV start is lower than using a contaminated one. And she's like, I don't think we should do it. And I was like, I don't trust any of you. I don't trust any of you, in fact, to even do another IV, because the other girl who tried to give me an IV, where was it? It was around here. She had put it in and then couldn't find or whatever, pulled it all the way out, and then was getting ready to try to put it in again and is like this close. And I'm like, whoa, no. You can't do that. That's not, you have to get a new needle. And she said to me, but I would have to get up and get it. And I was like, yes. You what? Like, what? Like, the tip of that needle is dull now. When you were digging around trying to get that catheter in my vein, you could have poked through the plastic catheter, and now there's like plastic around that you can shove directly into my vein your next attempt. I am immunocompromised. You cannot cut corners as a nurse when you are doing my medical care. You can't cause me more problems. The rare reactions that rarely happen to anyone else is extremely likely for an EDS patient. Anything that is the most rare outcome that could happen to a patient, the patient that happens to is an EDS patient. And that shit happens to us, all of it. All of the rare stuff combined. When you hear about, oh yeah, there's very rare reactions to this and this and this, you're assuming it's one random person. That's all the same bitch. It's us. Like the same girl, you heard about this crazy reaction from this one medication, this crazy reaction from this one, that was probably the same chick. The people who have rare things happen to them, it happens to them all the time. Like, it's likely. But if you guys have any advice in the comment sections for how to help place an IV on an EDS patient, I have no fucking clue. I don't know any. All I know is that when they use these two right here, we don't have any problems. This is the first time someone's hit a nerve in there, but thankfully all the pain has gone away. But then again, when they tried the forearm that one time when I got the colonoscopy, and they literally, like, they had to have pierced the nerve because it was like a lightning bolt. I screamed at the top of my lungs. The entire pre-surgical place, like, was looking at me, and I was like, what just happened? Like, that was like a lightning bolt. Like, yeah, I got shot with a lightning bolt. And I could just still feel like lightning going through my hand. And both the nurses, like, pretended they didn't know what was happening. And they were like, oh, you're just sensitive to needles? And I was like, no, that's never happened to me in my life. I just got shot by lightning. And then they kept it in. That's probably why I fucking had the nerve damage for like 6 months. My fucking arm was excruciating, and this hand too. I was having to wear a fucking hand brace sometimes because I couldn't use this arm in any way. It was horrifying. And right before I went in for my colonoscopy, I posted on TikTok saying that happened. And by the time I woke up, it was a fuck ton of nurses in my comment section being like, they knew they hit a nerve. And they didn't tell you. They blamed it on you and said that you're sensitive. What the fuck? That was also the same time where afterwards, when they took the IV out, and I, like, put pressure on it for a while, and then I got dressed, and as we were walking out of the building, I, like, looked down, and there's blood everywhere. There's blood, I forget what I was wearing. There's blood all over me, there's blood all over the floor, there's, like, a trail. There's so much blood squirting the fuck out of me. And they were like, we had to run back and be like, ah! That's never happened to me before. Or how about when I was in one of the worst flares, and they came in, and they fucking injected me. This was they treated me so horribly after I complained about the nurse, like, not following safety protocol on my IV, which is crazy. Like, what the fuck did you expect? To be able to cut corners and patients don't notice? Yeah. But they just came in, they gave me these injections, then they dipped immediately. I was, like, squirting blood everywhere. I had no idea this was happening. My friend had to witness this, but all the bed, the pillows, there was just blood everywhere because they didn't put pressure on it. Oh my God, the one nurse that fucking, I'm screaming at the top of my lungs because they missed my pain medication and I'm getting chainsawed to death. Up here, might I add. And my neighbor's nurse, my neighbor's telling her nurse, like, can you go help her? Like, she needs help, go help her. So she comes over and she's like, how can I help you? And I'm like, ah! And she was like, be quiet. And I was like, fuck, like, ah! And then she just left. And then, because I was saying fuck over and over and over the whole time. Like, when I'm screaming, that's what I'm saying. Fuck, Jesus, oh my God, holy fucking shit. That kind of stuff. I sound the same when I bang, you know. And then, when I asked her to come back and help me again, I'm, like, begging all of them for mercy and to save my life, because I can't talk about it on TikTok. She came back and she said, I don't like being screamed you at. I was like, excuse me? You're telling me you personalized my pain and are pretending to be the victim? You realize nurses are actually victims of verbal abuse all the time, and you're gonna pretend to be one? You're gonna pretend me being in pain and screaming fuck over and over and over was directed at you? Like, you really think the world revolves around you? And then this chick was working all week, and I had to see her face again and again and again and again, and I was like, this fucking... The guy who was on the farthest bed away from me, people's machines are dinging all the time. They don't have time to come and turn the machine off once it's done. And there's this big button that says silence. And when I was in the ER, they told me, hey, when your fucking machine starts binging, just click this silence thing. And I was like, okay. So then the guy in my room, I told him that because it was beeping over and over. And that nurse was helping him. And she sees him, like, press this silence thing, and she goes, oh, wow, you're so smart. And then he goes, yeah, the girl in the end taught me. And this was right after she had just fucking been a bitch. And she goes, never do that again. That's extremely dangerous. You cannot be playing with the machine. And I'm like, oh my God, lady. Like, they told me to press the silence button. They taught me to do that. Stop acting like I'm fucking trying to kill somebody. Another thing that doesn't make sense that happened when I was in the hospital is it got red right here and my nose skin started flaking off. And I was crying my eyes out. So, like, I'm thinking maybe was this breaking capillaries or something? Or, like, I just don't understand. How did all my nose skin peel off? It was like dry and like flaking for days.